Hi, I'd like to talk to you about meds for hypertension. We have so many classes to choose from. So, let's go. There's what we call thiazide diuretics. Example here is hydrochlorothiazide and chlorthalidone. Also, there's loop diuretics. Example is furosemide, ethacrynic acid, and bumetanol. Lasix, that is furosemide, is favored among this group for hypertension. Potassium sparing, example is spironolactone, amiloride, eplerenone. I'll still talk more on all these medications separately another time. We have beta blockers and we have beta 1 selective. Example is atenolol and metoprolol. While beta 1 and beta 2 non-selective is propranolol. We have beta 1, beta 2, and alpha blocker like labetalol. Beta 1, beta 2, alpha 1 blocker, carfentanil, usually used in heart failure. Beta 1, beta 2 plus intrinsic sympathomimetic activity like pindolol is also available, while beta 1 selective plus intrinsic sympathomimetic activity like acebutolol is available also. There's what we call angiotensin converting enzyme inhibitor. Example here is ramipril, perindopril, captopril, enalapril, lisinopril, quinapril. Now another time I'm going to talk in details about all this, but if the individual is allergic to it and is presenting with angioedema or unbearable cough, we can use another set of medications that I'm going to talk about next. So if someone is sensitive or allergic to angiotensin converting enzyme inhibitors, you can use what we call angiotensin receptor blockers. An example here will include Lusitan, Vasetan, Umesetan, Candesatan, and Irbesatan. There's a broad group called calcium channel blockers, and they are further divided into two, dihydropyridines and non-dihydropyridines. The dihydropyridines are usually used for hypertensive cases, while the non-dihydropyridines are used for arrhythmia. So example of dihydropyridines here are amlodipine, nifedipine, nicardipine, felodipine, and the non-dihydropyridines for arrhythmia is diazepam and verapamil. Like I promised, I'm still going to talk more on all this later on. The non-dihydropyridines, like I have stated earlier, example would be verapamil and diazepam for arrhythmias. There is another group called alpha and centrally acting sympathetic blockers. The alpha 1 blockers are prazosin, azazozine, terazosin. They are used in BPH. And the centrally acting sympathetic blockers are alpha-metidopa, clonidine, guanabans, and guanfacine. The vasodilators are used when the BP is very, very high, though we don't crash it down. An example here is sodium nitroprusside, hydralazine, guanidine or reserpine. We can also use isosorbate mononitrate or isosorbate dinitrate, particularly in heart failure. Endothelium receptor blockers, Bosutan, for treatment of pulmonary artery hypertension. Specifically, that's the drug of choice when there's pulmonary artery hypertension. Aldosterone and renin antagonists. The aldosterone antagonists are spironolactone, eplerenone, amiloride, triamterene. They can increase the level of potassium. So when you're using them, you watch the potassium level, or else you treat the patient to hyperkalemia. Renin inhibitors, like the name is, it inhibits renin. Aliskiren is the example here. Electrolytes that you have to keep an eye on while on some of these medications are potassium, if on AC inhibitors or angiotensin receptor blockers, or potassium sparing like spironolactone, eplerenone, amiloride, triamterene. Why? Because they retain the potassium and send the fluid out. And you have to check the level of sodium if the patient is placed on hydrochlorothiazide or chlorothalidone. These are some few scenarios. My father has gout. Please don't give him loop diuretics or thiazide. Why? That wasn't the situation for him. Never metidopa in liver disease. BPH and hypertension, yes. Rush to give him alpha-1 blockers. There is arrhythmia here, yes. Okay, look for non-dihydropyridine calcium channel blockers, verapamil or diazepam. Okay, this elderly man is hypertensive but also having diabetes mellitus and renal failure. Okay, go for AC inhibitors or angiotensin receptor blockers. In conclusion, so many medications are available to choose from. Let us choose wisely and wishing the affected people well. I'm promising that I'm going to work more on each of the classes later on and present each of the classes separately, looking for their side effects and the particular situations when you can use them. Thank you.